Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. We've got a good look at the biceps tendon here. We're going to put in a shaver and smooth out some of the torn labrum that we're looking at here. Hold the camera just for a second right there. So this is the labrum. And the real issue for us is the biceps anchor, and this is torn as well, which is what we suspected. And it's almost completely torn. I haven't shaved that yet, so that's almost completely torn already. So we're going to go ahead and do a biceps tenodesis here. This is the rotator cuff tear right here. So as we suspected and really already knew, you have a complete tear in the rotator cuff. So right now we're just cleaning off the footprint where the rotator cuff inserts. Okay. Okay, so I think that's good enough for now. As we look down the front of the shoulder, there's not much else to worry about here. Maybe some early arthritis, but not bad. As we rotate and look towards the back of the shoulder, that anatomy looks okay as well. A little soft tissue in our face, and we'll deal with that in a minute. But the next step for us, hold the camera, please. You got it? The next step for us is to take a spinal needle. I got it. Hand me that spinal needle. And then we'll take a grasper and a shuttle relay. So the spinal needle is going to come in right about here. Okay, there you can see how it's going through the biceps. Careful there. We'll take a shuttle relay. Either one. And we'll take that relay and pass it through. Two hands on the camera. Okay, and we'll back the needle out. And now we'll put a free suture through the relay. High-fi suture, please. Okay, so now we're going to pass the spinal needle through the biceps tendon one more time to create a purse string suture. You can see the needle. And that should give us enough of a hold right there. So we'll go ahead and feed that through and show you some more in a minute. Okay, so now that we have the biceps secured, we're going to go ahead and take some scissors and release the biceps, as you see here. Okay, now the biceps is released. And now we're going to go ahead and change positions with the shoulder and get to work in the subacromial space. Okay, so we're looking at this rotator cuff tear. This is the hole in the tendon. There's a little kind of mini ruler on the back of this shaver, so we can start back here. This is the posterior aspect of the tear. That's 1 centimeter, about 2 centimeters, about 3. It's more than 3. We are bigger than the ruler, so 1, 2, 3, about 4 centimeters in the anterior posterior plane. Not retracted a whole bunch, but normally it's inserted over here, so we've got a couple centimeters of retraction at least. So that qualifies as a large tear, borderline massive, but certainly a large tear. And now it's time to fix it. Hold the camera, please. We'll show you how we do that in a minute. Okay, so here's how we plan our repair. This is a spinal needle coming in from the lateral side. Here's the tear. We're just looking to see all the layers. We're going to place our first suture anchor in posterior right about here. We're going to have a second anchor more anterior. But as we plan our repair, our first anchor is going to go down right about here. I don't think we'll need 3, but we'll have a look. We'll start right here. Scalpel. Go ahead and pull that. So next we're going to place a drill guide down. There it is there. And then there's the articular margin. We're going to place our anchor down right about here. Go ahead and pull that and put the anchor in. We'll show you the complete step of inserting an anchor on this first one. Push it down against the bone first before you hit it. But not too hard. Okay, straight down. Gentle first. Keep going. You're good. One more. Okay, that's good. So now just pull straight back. Hard. Harder. Okay, hold on. Okay, so there's the anchor. It's got 3 sutures. We pull back on the sutures to make sure the anchor is seated, and that's very solid. Now I'm going to reach in from the right side of the screen to take the first suture that we'd like to work with out the front here. So we'll pull back. Looks like these black and white sutures are positioned in the best spot for me. You can see the ribbon there. We'll go ahead and hold the gray cannula in. Keep that in from now on. Okay, and so now we've got the first suture tucked out of the way. See how it goes into that cannula. These other sutures we pull out of the way, and now we're going to keep this cannula in. It's going to tend to come out. We're going to put a grasper in the front to Garth here. And straight to me, crescent to me. Just not all the way, but that's perfect. Okay, and so now I'm going to take the suture hook. That's going to come in here. And you can see what we're trying to do. We're trying to pass a stitch just like that. So hold the camera here, switch hands. Okay, I got this now. I want to make sure I'm getting all the layers of the tendon, so I reach up, make sure. And there you can see us skiving, and I just want to confirm, and it looks like we're all the way underneath, so that's good. Slide this up, perfect. So we'll go ahead and retrieve the relay. We'll hold left hand on the cannula. Push it in, yep, perfect. And now we'll go ahead and load that black wire with the suture. Okay, I'll show you some more in just a second here. Okay, so here you can see the first suture coming underneath and out the top of the tendon here. I'm going to reach in and get the partner ribbon. This is this black and white one. That's why there's 3 different colors, so we know which go together. So we'll take just one, like that. And we're going to tie that knot right there. That's going to give us a loop right there. Okay, hold on. Okay, so we've got the first one tied. You can see the knot is right there. and the suture comes across the top and it's snugging down that posterior part of the tear. Now we're going to do step 2, which is to take another suture and do the same thing. And you can kind of see how we're going to march across and repair this big hole in the tendon. Grass vertigarth. Okay, so we've got the first triple loaded anchor tied, and that's really doing a nice job securing this posterior part of the tear. And now we're going to place a second triple loaded anchor right up here. We've got about half the tear left to fix, so that sounds about right. Looks about right. We might be able to use, I think we can use the prior hole, so we'll go in right there. Okay, we're all done here. Let me show you what we've accomplished. We've got one triple loaded anchor in the back, second triple loaded anchor in the front. That hole that was there, that 4 centimeter tear, is completely repaired down to bone. The biceps tendon sutures are tied right there. You can see that those suture tails are for the biceps. The rest of these are for the cuff. I've got one more little regenerative medicine trick to try, which is to take a little punch and make some little holes in the greater tuberosity. And the purpose of that is to enter the bone marrow space where some of the cytokines and growth factors are that promote healing. So we'll make a little tap here. Keep going. Okay. And again, that just lets out some of the stem cells and other things that live in our bone marrow. There's one hole. We're going to make another one. And then we're going to get you back to the recovery room. So the second hole, why don't we do that right about here. Okay. And then if you watch closely as we turn down the pressure, you'll see some of the bone marrow elements. See, you can already see some of the fat there. But you'll see some of the bone marrow elements start to come out. Little droplets there. See, there goes one of them. That's a droplet full of stem cells. Just kidding. Okay, so we're going to finish up here and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.